there are a few groups of people that are unable to take hormones, and the key one really is those that have had a personal history of breast cancer, and that's even if it's estrogen receptor negative. I don't base my decision to start HRT on whether the tumour was estrogen receptor negative or positive, and I often write to the oncologists, the cancer doctors, and I seek their advice, and the response is always the same. It's I wouldn't recommend them taking it. There are exceptions. Things like vaginal estrogens are generally accepted as being okay if you've had a personal history of breast cancer because of the very, very small dose of estrogen that gets into the body. So for these groups of people, and for those that just want to avoid hormones, when are the other options an option? So if you've got very mild symptoms and they're very short lasting and not that troublesome, then simple things like lifestyle, so exercising, changing your diet, acupuncture, losing weight can have a real impact on your mood, your anxiety, and your quality of life. Things like food, so red clover, soy, these have plant estrogens in that can help. But beware, in breast cancer, you should really avoid these as well because they're still estrogens. Then you've got the herbal options, Holland and Barrett, like ginkgo biloba, ginseng, black cohosh, St. John's wort, and there is some evidence for some of these of a benefit, certainly for mild symptoms. If you're taking St. John's wort, just be very careful because it interacts with a lot of medication. So check with your doctor before you start taking St. John's wort. And then you've got non-hormonal. So for those that really are struggling with their symptoms, such as those with breast cancer who can't have HRT, there are things like clonidine, which is a blood pressure tablet that can help with hot flushes. There are antidepressants that can help with some mild symptoms, or neuromodulators, things like gabapentin, pregabalin, that can help. However, you need quite big doses, and there can be quite reasonable side effects to some of these medications as well. But there are options out there, and you have to accept that the side effects, especially for the herbal options, there is a cost, and for many it will delay getting to receive HRT, and then doesn't always work. So, but there are options to discuss with your healthcare professional.